Hello, I am Ioannis Savas, and you are listening to an episode of the official podcast of the Unit of Anesthesia and Intensive Care, School of Veterinary Medicine, Aristotle University of Thessaloniki. Today, I'm hosting two colleagues from the School of Veterinary Medicine, University of Thessaly in Karditsa, Assistant Professor Evgenia Flouraki, and Nondas Lukopoulos, who is a PhD student. And today we're going to discuss together a new publication of our team that is a joint work between the University of Thessaloniki and Thessaly. And this publication was published recently in the journal Animals, the effect of lidocaine splash block followed by suspensory ligament massage in female dogs under ovariohysterectomy. Hello guys, how are you doing?
Hello, we're fine.
That's good. Hello Nondas.
Hello, thank you for your invitation.
How did you come up with this idea of using lidocaine and massaging the suspensory ligament? I know that there are several publications on this topic because it is a hot topic for anesthesia. We all know that during the ovariohysterectomy, it is a challenge for the anesthetist to adequately suppress nociception in the suspensory ligament. How did you come up with this idea?
Well, for me, actually, it was a common practice in our private practice where I actually work and anesthetize dogs in several cases. And I noticed from 1 year ago, maybe, that when we're massaging the suspensory ligament with or without lidocaine, there was an effect. I don't know why, we don't know why, but there was an effect on heart rate, which was lower, and on the respiratory rate, which was also lower. And so we know that in the literature, there is quite difference in the outcomes in several cases that have been reported. And some authors say that lidocaine actually works if it's instilled or if it's applied as a splash.
Or injection?
Yeah, or injection. But still, there's not an accurate guideline if there is actually an effect of lidocaine in suspensory ligaments. While in male dogs, when undergone castration, we know for a fact that lidocaine intratesticularly actually works. And it has an effect on the nociception and on pain afterwards. So we just thought about why not try it, make it a research, and see if the outcome actually works for us and for the veterinarians. So that was the idea.
So it started as a personal observation of your
Yes.
clinical practice, and then you designed this clinical study. Nice. And can you explain exactly or in details or more details the methodology you used in this research?
Yes, of course. First of all, our study was prospective and randomized, as well as a double-blinded clinical trial designed to assess lidocaine irrigation on how much was it effective combined with a 1-minute massage on the ovarian suspensory ligament. So we enrolled 38 female dogs. Then the dogs were randomly assigned to two groups. One group received 0.5 milliliters of lidocaine 2% applied to each ovarian suspensory ligament, followed by a 1-minute massage, while the control group received the same treatment with saline as placebo. At last, the outcomes showed that the lidocaine group had significantly fewer cases requiring rescue analgesia, which demonstrated the technique's effectiveness.
So what are the most interesting findings of our clinical study?
We found that the group with lidocaine had almost on 100% success. I mean, only 2 dogs required rescue analgesia during this operation, and these dogs were starting to require analgesia before the lidocaine splash because the manipulations was a little bit more harsh than we wanted to. All the other dogs were just laying flat with no changes in heart rate, no changes in respiratory rate, although in some cases we needed to retract the ovary quite hard. And on the other hand, the control group almost in all cases, the dogs reacted, and that was probably an effect of the pre-medication, which was only buprenorphine, or the quite not low but standard anesthesia with isoflurane at 1.2 only, so with nothing else. So it had quite significant difference, the effect of lidocaine on the suspensory ligaments.
So you're telling that as we say in anesthesia, when the local anesthetics are good, when the blocks are good, we have a flat line in the monitoring parameters during anesthesia. It's completely flat line.
A flat line, yes.
Uneventful anesthesia. Yeah, nice. Now, what is the reasoning behind the massage of the suspensory ligament? Is there an explanation how this manipulation, how this maneuver may have an effect?
Well, we don't know exactly how massage works in this occasion. We don't know the exact mechanism of actions. But from the existing literature, we know that massage in general improves the local absorption and distribution of lidocaine or other local anesthetics. And by increasing blood flow and slightly warming the tissue, massage facilitates the penetration and a more uniform spread of the drug into the deeper layers of the ligament, maximizing potentially its anesthetic effect. From a physiological perspective, the act of massaging may activate mechanoreceptor nerve fibers, such as alpha-beta fibers, responsible for transmitting non-painful stimuli, like pressure. This activation can reduce pain perception by engaging the gate control theory, and according to this theory, stimulating non-painful signals can effectively close the gates to pain signals being transmitted to the brain.
Yes, okay. Again, the gate theory, the famous gate theory. Normally, we apply the activation of the mechanoreceptors after the painful stimuli, but you have applied before the painful stimuli.
Yes, which led this approach.
So why did you choose buprenorphine in your premedication protocol and not another pure opioid agonist?
We try to engage to the theory of less opioids, of opioid-sparing anesthesia. We took under consideration that, especially in our country, there is quite a restriction in opioids. So it's not easy for the veterinarians to use an M opioid agonist, a full M opioid like morphine or pethidine, which are not available. And buprenorphine is available in most countries, as well as are also. And we also thought, and we had a discussion about all the other literature researches that actually used methadone or morphine in premedication, which may have hidden the effect of the lidocaine. So we also think that buprenorphine is quite a partial M opioid, but also has a partial analgesic effect, but still ovary hysterectomies are of medium pain level, so it could be actually effective for this procedure. So that was our choice to make a protocol that can be actually used in clinical practice, which are available in most cases, especially Greece, and to be actually affordable. It's quite cheap and easy to get opioid.
So from the social media comments, I can understand that this publication is very helpful for the general practitioner. What is your opinion about this? Can this concept be applied in clinical practice in general?
Well, this technique is actually very practical for everyday veterinary surgeries. First of all, it's very simple. It's affordable, and it doesn't require any special training or equipment, so it can be easily used in most clinics. And according to our results, by applying a small amount of lidocaine and combining it with a short massage, without adding much extra time to the surgery, veterinarians can significantly reduce the need for additional pain medications during surgery. And in addition to this is particularly useful in places where access to opioids is restricted, or where there are other concerns about their side effects. I think the best part about it is how accessible this method is. It doesn't add much time to the procedure, and it's an affordable way to improve the quality of care.
Thank you very much for this conversation, Evgenia and Nondas.
Thank you very much.
I'm Ioannis Savas. Until the next episode, stay tuned and be skeptic.